If you have someone in your family who has gone through stroke or is going through stroke, I absolutely understand how difficult is the situation. Not only the patient is someone who suffers, but it's also a difficult time for the caregivers. And sudden paralysis of one side of body is a major shock for everyone. Suddenly, a patient who is able to walk, who is independent, find himself unable to do some basic activities and do some basic mobility. Now, this is the time when your patient or your relative is bedridden, and there are a lot of chances of development of certain complications which, if develops, leads to some secondary problems which are in themselves very difficult to manage. Hence, it's very important that you position the patient in a correct way that prevents maximum complications as possible. I'm talking about the bed positioning techniques for the stroke patients, and we are going to discuss all of that in today's video. So if you who are someone who is having a stroke patient at home, make sure to watch this video till the end, because this video is very important for you. So let's get started with the bed positioning technique for a stroke patient. In order to position your patient in the right way, all you need is good amount of pillows and bed sheets. These two things are very helpful in maintaining good position. Let's start first with positioning of the head. Take a bed sheet or else a quilt and roll it. Roll it on the sides and then place it underneath the head so that the head stays in neutral position. Along with head support, also take help of a pillow and place it on the affected side. This helps in keeping the affected hand away from the body. This prevents the adductor contracture or else deformity in the stroke patient. In order to support the legs, again take the help of a bedsheet roll, something like this, and then place it on the side of the body in a way that it stays next to the leg, which prevents outward rotation of the leg. When the stroke patient is lying straight on the bed, it's very important to give support to the knee joint. To do this again, we need to take a bedsheet roll and place it on the side of the another bedsheet roll that we kept. Then rest the knee on it. So as you can see in this picture, I have demonstrated the right positioning technique or else way for a stroke patient when he or she has to lie down straight. In this positioning, the shoulders should be away from the midline, the knee joint should be supported with a bedsheet roll, and there should be a bedsheet roll which should be placed on the side of the leg in order to prevent side bending or a side rotation of the leg. The second position in which a patient can lie down is the side lying position. So when a patient is lying on a side lying position, a bolster is needed. This bolster helps in resting the affected leg over it. In order to maintain a good positioning of the hands should stay away from the pillow and the affected side or the upper side of the hand should clasp forward and the leg should be resting on the bolster. This applies for both the sides. To summarize, a patient can be positioned in two ways, straight lying and side lying. Both the positions are equally important. Ensure to use pillows and bed sheets in adequate way in order to prevent and maintain a correct positioning technique. Take help of your physiotherapist to understand this method and practice it regularly. So friends, this was a brief idea about how you can position your stroke patient at home on his bed in order to prevent maximum complications as possible. I hope you found this information useful. If yes, make sure to subscribe, share this video and like, and don't forget to comment if you have got any queries related to any of the videos that we make on our channel. See you next time. Bye bye.